Our lovely patient, who is 52 years old, is about 4 months out from her breast augmentation. And she comes in today and she's very graciously agreed to share some of the thoughts and concerns she had leading up to her surgery.
So before I started this process, I did a lot of research, looked online, talked with other physicians, went to other appointments, and met with doctors in regards to having some sort of fat transfer for the breast augmentation, because I did have a lot of concerns regarding the implants being placed in the breast. I did have some issues a few years ago with some calcifications that needed a breast biopsy surgically done. So it was just a concern. But after meeting with Dr. Claytor, going through all of my concerns, I was reassured. I was confident in my decision to go through with it. And I have been extremely impressed with everyone that has been involved in this process, from the staff to Dr. Claytor to the hospital to the aftercare. I couldn't have asked for anything more.
Oh, you're so generous. Thank you so much for those kind words. We were talking earlier about your questions when you first came in about breast augmentation using your own fat, and certainly something I do, and share with everyone the process we went through so that I could educate you as to what was possible.
So Dr. Claytor looked at my full body composition, looked at my breast tissue, looked at my past history of having the calcifications and the dense breast tissue itself. And he, made his best professional, educated opinion on the route that we should take in regards to restoring my breasts to their original size, look. And then we decided that because of my composition, that I didn't have enough of the fat tissue to actually get the volume and the fullness and the look that I was going for, because I did come to my appointment with a picture of my ideal, look that I was trying to obtain. And from that process, we went through all of the different types of implants and what complications there could be. But, on the flip side, we talked about behind the muscle, in front of the muscle. Being an athlete, we chose to go in front of the muscle, which was the best decision. And my recovery, within a month, I was back to full exercise. So it was good.
Well, I thank you for going and telling that whole story. And I'd forgotten you did bring in a picture of a patient in a bikini. And I do like when people do that, because it really helps guide me. And how do you feel that your results matched that picture that you brought in?
I think if you put me in the bikini next to this person, you would probably say, wow, that's almost identical. So yeah, I couldn't be happier with the end result, and I hope I can say this and he doesn't edit it out, but when my husband looks at me, he's like, Dr. Claytor is the effing bomb in regards to his quality of work.
No, we're definitely not going to edit that out. That's awesome. That's awesome. And then you're absolutely right. You did mention, and I appreciate you bringing that up, that we put your implants in front of the muscle, which is something that we hear people coming in, they're hearing different things from Google as to whether or not they could or couldn't go in front or behind the muscle. And many patients, especially with the newer technology that we have in implants today, do extremely well in front of the muscle. And so yours is behind the fascia, behind the breast tissue and the fascia of the breast, but in front of the muscle. And so you have no animation when you move your arms at your chest. Is that correct?
That is correct. I take Pilates, and I'm around a whole bunch of women every day, and they're all in their little sports bras doing it. And not once have I had one come up to me and say, you've had your breasts done, because they look that natural. There's not any bulging or ripples or anything that is showing signs that I've had it done. And like I said, I was back within a month exercising again. So no one really kind of thought I just went on vacation that I exercised with and came back. So, and thanks to heavily padded bras before, there's not, now that I don't need that. So it's
awesome.
Nice.
That's awesome. Well, we certainly shoot and aim for a natural look, and I'm thrilled to hear you so happy with your results. The last question I always like to ask is this something that you would recommend to a friend?
Absolutely. I mean, I waited a long time to have this done. Before kids, I definitely did not need a breast and, any kind of augmentation. I was a full C, and it fit my body. And then I breastfed 2 boys, and as I've gone through menopause, my breasts were just not coming back, and no amount of exercise would ever change that. And so for me, yes, I would definitely say if it's something that after going through my experience, I would recommend for someone to have done.
Awesome. Well, thank you for sharing your story.
You are more than welcome anytime.
Thank you.